Hello, my name is Dr. Mark Pohlman. I'm the Director of Respiratory Therapy at CMC, and I'm here today to talk to you about the benefits of exercise in the pulmonary rehab class that you're in. In medicine, we like to look at outcomes, and we like to try to improve outcomes. So there are a number of things that we've studied in regards to pulmonary rehab that we like to try to improve for patients. Some of these things include improved quality of life, a reduction in your shortness of breath, improved survival, a reduction in COPD exacerbations. So there are a number of outcomes that we like to look at, and our goal is to try and improve outcomes. So we'll talk a little bit about some of those outcomes today and some of the benefits you can expect to receive from going through this class. Just a bit of an overview on what happens with lung disease. There's a concept known as the dyspnea spiral or the shortness of breath spiral. This is where when a person has lung disease, they tend to be more sedentary. And when they become more sedentary, they start to get deconditioned and they get somewhat out of shape. And that deconditioning or getting out of shape can lead to an increase in your shortness of breath. So our goal is to break that spiral by getting you to exercise and move and improve your conditioning. So the cornerstone of treatment in the class is a program that centers upon lower extremity aerobic exercise. Some examples of that include exercise bike, new step, treadmill, elliptical, but essentially it's aerobic exercises that involve your lower extremities. This is kind of the centerpiece of the class, and that's what leads to improved outcomes. Some of the things that are measured and have been shown to be improved in patients that complete the 8-week course are an improvement in your maximum exercise capacity. It's the maximum amount of work you can do. Say, for example, if you were doing a treadmill stress test, your peak amount of work would increase. We also want to improve your endurance. That's how long you can do things for. Often we measure your walk distance before and after the class, but pulmonary rehab has been shown to improve a person's walk distance from the beginning of the class to the end of the class. It will increase the distance that you can walk in the same period of time. It also will reduce your shortness of breath. And that's in part due to breaking that dyspnea spiral and improving your overall conditioning and lessening that sense of shortness of breath that you have. Now, there are a lot of other outcomes we look at too that have been shown to be improved with pulmonary rehab. Another is quality of life, and there are a number of measures that we look at in regards to that. There's general measures such as anxiety and depression and your overall sense of well-being, a reduction in fatigue and pain, improved social functioning. So those are kind of general measures, but then there's also lung-specific measures that we look at too, like a reduction in shortness of breath, a reduced frequency of symptoms, and reduction in the number of flare-ups of your lung condition that you have. So there are a number of specific quality of life measures that we look at. Now we measure this before and after the class. We have lung-specific measures that we look at on a questionnaire, and we also have general quality of life measures that we look at as well. Other improved outcomes include a reduction in healthcare utilization, meaning you'll just use less healthcare in general. Pulmonary rehab class leads to a reduction in the number of hospital admissions. If you do get admitted to the hospital, it leads to a reduction in your length of stay, meaning that people who have completed the course tend to be discharged from the hospital sooner. It leads to fewer presentations to the emergency department or urgent care, and also fewer calls to your provider's office. As a consequence of decreased healthcare utilization, it also leads to a reduction in healthcare dollars that are spent. So the class, in essence, pays for itself. Now, another important outcome that we like to measure is survival, or how long a person will live. Now, in pulmonary rehab, we think it leads to an improvement in survival, but there have not been high-quality studies that have proven this, such as randomized controlled trials. But there are some lower quality studies that do suggest there's an improvement in survival. For example, there have been studies done that show if you exercise more than 150 minutes a week, you'll live longer than somebody who exercises between 0 and 150 minutes per week. And if you exercise between 0 and 150 minutes per week, you'll live longer than a person who doesn't exercise at all. So we do think it leads to an improvement in survival. People that are able to complete the pulmonary rehab class have an improvement in survival. And if you're able to improve your walk distance by 150 feet from the beginning of the class to the end of the class, that also leads to improved survival. Psychological outcomes. Some of the outcomes that are improved are a reduction in anxiety and depression. There's improved cognitive function. I think anybody who's exercised, after they exercise, you almost feel mentally sharper. There's an improvement in your perception of disease and how well you understand your disease. There's also an improvement in confidence and independence. So there's a number of psychological outcomes that are improved. Now, how long do these benefits last for? If you complete the 8-week course, some of the physical benefits will last up to a year, but it starts to decline over that year. So if you were to exercise for the 8 weeks, some of those benefits would still be present even at the end of the year. The psychological outcomes last much longer, and that's in part due to some of the education that's provided for you in the class, and that's something that you probably will carry with you indefinitely. So some of the psychological outcomes will last sometimes for several years. Probably the most important thing to remember, though, is that if you stopped exercise after 8 weeks, the physical benefits will start to decline over that next year. It really kind of emphasizes the importance of ongoing exercise. It's important for you to continue to exercise even when the 8-week class is completed. Longer programs, greater than 12 weeks, people tend to make greater gains if the program is longer, meaning these benefits in endurance and maximal exercise, this will all last longer if the class is longer. And then there's also maintenance programs that continue for months and sometimes years. And those are very good too. Those also lead to improvements in endurance and really kind of a maintenance of all the gains that you have made, and sometimes even greater gains. So the bottom line is, if you continue to exercise after the class, you'll continue to have the physical benefits that you got during the class. Now, what about high-intensity exercise versus low-intensity exercise? It's very difficult to exercise at a high intensity for a long period of time if you have lung disease. But with the exercise physiologists, they talk with you a bit about interval training. I mean, you exercise high intensity, alternating with low intensity, high intensity and low intensity. And that leads to improved endurance and improved peak exercise if you're able to do that, compared to just nothing but low intensity exercise. Now, if all a person is able to do is low intensity exercise, that is definitely better than not doing any exercise at all. What about if you incorporate upper extremity training into your aerobic exercises? That leads to even further improvements in shortness of breath and endurance and maximal exercise. So an example of that would be, say, an elliptical where you have your arms, resistance for your arms, or an exercise bike where you have resistance for your arms. That leads to greater improvements than if you just did lower extremity exercise alone. So if you incorporate upper extremity exercise in, you'll have even greater improvements. And that's in part because if you monitor your heart rate, you'll see that your heart rate is higher when you're doing upper and lower extremity versus just lower extremity alone. What about weight training? Now, what I've talked about previously is mostly aerobic exercise. That's where you get on a treadmill or an exercise bike. But what about weight training or strength training? An example of that would be the marathon runner, say, versus Arnold Schwarzenegger, who is purely strength, versus a marathon runner who is purely endurance. So they do strength training in the class, and strength training is important. Classes that have strength training lead to improvements in strength, which is key, obviously. It also leads to an improvement in muscle mass, and we think it leads to an improvement in endurance as well. So strength training is very important. It leads to improved ADLs, or your ability to do your activities of daily living, or ADLs. If you think about it, if you're stronger and you have more muscle mass and more strength, it's easier for you to bend over and pick something up off the floor, or it's easier for you to go up and down stairs, or do work around the house, or cleaning, or yard work. Greater strength leads to improved ability to do your activities of daily living. So strength training is an important part of pulmonary rehab, so it is also a key component to the class. So in summary, there are a number of improved outcomes you get from going through this class. There's improvements in your functionality and your ability to do things. There's improvement in your psychological state of well-being. There's a reduction in your shortness of breath, less healthcare utilization. There are a number of benefits. The cornerstone for the class, though, is really doing lower extremity predominant aerobic exercise as one of the key components. If you can incorporate upper extremity exercises into that too, that will be increasingly beneficial for you. It's vitally important for you to continue the exercise after the class concludes itself. You'll continue to maintain where you're at, but probably also make ongoing improvements in your endurance and strength. Strength training is important, but it's not the only thing. Just doing strength training alone probably will not be as beneficial as if you do the aerobic exercises that I had mentioned. So thank you so much for listening today and your participation in the class. We're happy to have you all here. I think that's the first step, but I think that you'll really enjoy the class and you'll be very surprised by many of these improved outcomes, and I think you personally will experience many of these improved outcomes as you progress through the class. And I encourage you to keep exercising.